everyone, welcome back to my channel Dental Cafe. So today we are going to discuss about the techniques of cleaning and shaping. In this video we are going to discuss about the step back technique. Okay, then let's begin the video. What is cleaning and shaping of canal? In simple words, you can say cleaning and shaping is the removing of the pulp tissue and debris from the canal and shaping the canal to receive an obturating material such as gutta percha. As you can see in the figure, with the help of file, we can clean or remove the debris and the pulp tissue from the canal. And then we'll sequentially increase the file size to shape the canal so that it will prevent the any leakage and further infection in the canal. So we'll clean and shape the canal, and then we'll compact filling will be done in the canal so that there is no leakage in the canal. Now, moving to the various techniques of cleaning and shaping of canal. We have a different techniques of cleaning and shaping. First one is the step back technique. Under step back technique, we have a conventional step back, and the second one is the passive step back. We'll discuss these techniques in this video. Next technique of cleaning and shaping is step down technique. Under step down, we have crown down pressureless technique, double flare technique, and balanced force technique. And the last technique is the hybrid technique. So hybrid itself means a combination of step back and step down technique. Now begin with the step back technique of cleaning and shaping of canal. What is step back technique and how we'll perform this technique? So it involves three main steps. First, we'll prepare the apical third of the root. Then we'll prepare the middle third, followed by the coronal third of the canal. How we'll prepare? Let's see in the video. So look at the figure. In step back technique, we are going back. So we are preparing firstly we are preparing apical third, then followed by middle third, and then coronal third. We have to go backward, means we have to go from apex to crown, not from crown to apex. If we are going from crown to apex, it means we are going downward. But in step back, name itself says we have to go backward. It means we have to go from apex to crown. All these are theoretical. Now try to understand how to perform this technique clinically. Initial steps are same in all the RCT procedures. First of all, we have to prepare an access cavity and locate the canal orifice. As you can see in the figure, we will prepare the access cavity and locate the canal orifice. Next step, we'll begin with the 10 number file. To estimate the working length, we'll place the file to the working length and then take the radiograph so that we have an idea about the working length. As you can see in the figure, with the help of 10 number file, we'll estimate the working length, and then we'll remove the file and irrigate the canal. Irrigation is a very important point. After each and every step of filing, must irrigate the canal to remove or to break the debris. First file we'll use is 10 number file. Start with the 10 number file so that we can estimate the working length. How we will estimate the working length? With the Ingalls radiographic method that I have already told in my previous video. Then we'll use 15 number file. Then we insert the 15 number file to the full working length in a gentle watch winding motion. Then again we'll remove the instrument and irrigate the canal. Then in next step we'll insert the 20 number file and we'll clean and shape the canal until file becomes loosened. We'll place the 25 number file to the working length, and this is the master apical file. After 25 number, we will not insert the file to the working length because this is the master apical file. This is the last file which prepared the apex. Very important point, do not forget to recapitulate the canal, because if you're not recapitulating the canal with the smaller instrument, smaller size file, debris will get collected. So to break up the apical debris, we have to recapitulate and irrigate the canal with the smaller size file. Look at the figure. First we are using 15 number file to the working length. Then we'll clean and shape the canal, and then sequentially we increase the file size. We'll using 20 number file, cleaning and shaping the canal, and then 25 number file to the working length, and this file is considered as a master apical file. It means now apex is prepared up to 25 number file. After 25 number, we'll decrease the size of the working length. Now we increase the file size. We are using 30 number file, but this file should be 0.5 to 1 mm shorter than the working length, because 25 number file is the master apical file. Then we are using 35 number file, which is 2 mm shorter of the working length, and then 40 number file, which is 3 mm shorter of the working length. It means we are using step back technique, mean we are first preparing apical, then middle, and then coronal. That's why we are shortening the length 1 mm, 2 mm, and then 3 mm. So this is step back technique. And don't forget to recapitulate with the master apical file. Look at the figure. As you can see in the figure, firstly we are using 30 number file, which is 1 mm short of the working length. Then we are using 35 number file, which is 2 mm short of the working length, and then 40 number file, which is 3 mm short of the working length. Mean we are going backward. We are going from apex to the crown. That is why this technique called step back technique. I think now it is very clear why this technique is called step back, because we are step backing. The final preparation of coronal root and middle root portion is done with the GG drills. So we are using size 3 GG drills to prepare the coronal root area, and size 2 GG drill to prepare the mid root area. And how you will identify the size 2 or size 3? As you can see, there is a ring in the GG drills. If we have a 2 rings, it means it is a size 2. If we have a 3 rings, it means it is a size 3. Why we are using GG drills? We are using GG drills for flaring of the coronal third of the canal, for better canal cleaning coronally. Now, what are the advantages of step back technique? First one, it is a very popular technique with 2% SS file. And second, ability to prepare proper apical stop prior to preparation, because we are preparing apical third first, so we will make a apical stop first before preparing the further canal. What are the disadvantages of a step back technique? First of all, extrusion of debris into the periapex, because we are preparing apex first, we are not removing middle and coronal portion debris, so there is a more chances of extrusion of debris from the apex. Difficult to penetrate the instrument into the canal, because we are preparing apical third first, we are not preparing coronal middle third. So there is some disadvantages of each and every technique. So this is a disadvantage, because there is a difficult to penetrate the instrument into the canal to reach the apex. Third one is a time consuming because this technique is performed with the help of hand. Manually we can perform this technique, we cannot use rotary files in this, so this is a time consuming technique. I hope this video is helpful for you to understand what is step back technique. In next video, I'll tell you step down technique, so that you can differentiate between the step back and the step down technique and how to perform. So do like, share and subscribe my YouTube channel, and hit the bell icon for the latest update.